Some people may be more genetically susceptible to having high blood pressure. However, it is your environment working on your genes that increases your risk. In other words, your underlying cause of high blood pressure is determined by what you eat, how much you move, and how stressed you are. High blood pressure, also known as hypertension, affects around 30% of adults. A scary fact is the higher your blood pressure, the lower your life expectancy. Some people even call hypertension the silent killer. Think of it this way. When you have healthy arteries, blood flows, freely delivering nutrients and oxygen to all your vital organs. High blood pressure means there is an increased amount of blood flow, which can cause damage to your arteries and restrict blood flow to important organs. According to the State of Obesity, 60% of Americans with hypertension are overweight. However, losing 10 to 20 pounds can actually normalize your blood pressure. Society often prescribes medications for these disorders, which is not an innately bad thing and is sometimes a necessary thing. But a question to ask yourself is, what caused my high blood pressure in the first place? Be sure to like this video and subscribe for more nutrition-related content. I feel like you can't mention high blood pressure without first talking about salt. Salt, or sodium, is linked to hypertension. However, it is important to remember that sodium is essential for your overall health. What's even more important though is our sodium to potassium ratio. When this ratio gets out of whack, high blood pressure often follows. So we want optimal amounts of both to stay healthy. Some great sources of potassium include spinach, broccoli, avocados, squash, papayas, and bananas. However, if you're dealing with high blood pressure, you don't want to overconsume sugar, so maybe put the papayas and the bananas to the side for now. Some doctors prescribe people with high blood pressure to completely eliminate sodium. This is not great advice. A stat came out saying that patients with heart failure who also ate a salt-restricted diet were 85% more likely to die or be hospitalized than patients who didn't limit their salt intake. The trick with salt is to avoid the refined salts that are found in processed foods. Sodium found in natural whole food is fine. In fact, you should be getting around 2,300 milligrams of salt every day. When you do use salt, aim to use products like pink Himalayan salt. So in summary, use salt in its natural form. The simple formula for improving your heart health is to get rid of the junk and eat more whole, real, unprocessed foods. Though this is simple in theory, it can be really difficult to do practically speaking. Getting rid of this junk food helps reduce inflammation and normalize your blood sugar. Adding in real food helps to increase your consumption of phytonutrients, which are plant molecules that give your body the nutrients it needs. Here are 5 nutrition steps to help you lower your blood pressure naturally. Eat more plants. Aim to eat more fruits, vegetables, nuts, and seeds, which are rich in fiber, healthy fats, and other important nutrients. As mentioned earlier, we also want to eat more potassium-rich foods that help our body get rid of excess sodium and relax our blood vessels. Aim for foods like Swiss chard, kale, Brussels sprouts, broccoli, avocado, mushrooms, green beans, and tomatoes. Eat balanced meals. We want to prevent high blood sugar spikes. And a way to do this is to never eat carbohydrates all on their own. Try to eat what I call my Core 4 method, which is eating balanced meals that consist of protein, fat, fiber, and veggies. For example, have salmon for dinner with roasted vegetables sauteed in olive oil. And if you want to, add some yams for extra flavor and color. Aim to eat the rainbow every single day by trying to get 8 to 10 cups of vegetables. These vegetables are disease-fighting, anti-inflammatory, phytonutrient-rich, filled with vitamins, minerals, fiber, antioxidants, and other disease-fighting properties. Eat your veggies. They're like medicine. They're amazing. Ditch the sugar. Sugary foods and refined carbohydrates would go into the same category because they all turn straight to sugar in your body. Sugar creates high insulin levels which can lead to insulin resistance, inflammation, high blood pressure, type 2 diabetes, increased risk of cancer, poor sex drive, and even depression and anxiety. Eat good, healthy fats. Contrary to some people's beliefs, eating fat does not make you fat, and quality fat is not bad for your heart. Aim to eat healthy fats from great sources like olive oil, avocados, nuts, seeds, extra virgin coconut butter, organic full-fat coconut milk, free-range eggs, fatty fish, and grass-fed meats. Also, really try to eliminate some of that hydrogenated fat that comes from shortenings, margarines, and vegetable oils. Eat more fiber. Fiber is fabulous for your overall health and can do amazing things for your cholesterol. Soluble fiber can actually reduce the amount of cholesterol in your bloodstream. A product I love is inulin fiber. This magical white powder is amazing and can be added to literally anything. I love to put a scoop or two in my coffee. You can dissolve it in water, you can put it in your smoothies, you can add it to chia puddings, oatmeals. I even use it in my baking all the time. Another great tip with fiber is adding 2 to 4 tablespoons of ground flaxseed into your diet every single day. A great way to do this is to add it to your morning smoothie or sprinkle it on your salads or add it to your shakes. I am just going to briefly touch on movement and stress. Regular physical activity is so important for your mood, your weight, and your overall health. Try adding 30 to 45 minutes of movement into your everyday, at least 5 times a week. Go for a walk, do a HIIT workout, try some circuit interval training, or even play around with strength training. Exercise is powerful medicine, and to be frank, you can't age successfully without it. We were designed to move. If you're struggling with including movement in your routine, find movement that you love, and maybe even movement that helps you reduce your stress. Managing stress is necessary for nearly all chronic health conditions. Stress alone can cause inflammation and high blood pressure. That's how powerful it is. Try relaxing exercises like yoga. Practice breathing, meditation, walking, and spending time relaxing on a regular basis. I want you to remember that wherever you are on your health journey, it's okay. It took time for you to raise your high blood pressure, and it's gonna take time for you to lower it. Give yourself grace and try to be patient as you journey towards sustainable, transformational change.